My name is Reagan Byrne. My audience is over here. And today I will be showing how physical therapy is much better than surgery and how it can help. Have you ever had joint pain or muscle pain and the doctors told you that surgery was the only solution? Well, surgery is not only the solution, but physical therapy can help as well. I would recommend trying physical therapy first before doing the surgical option. If physical therapy doesn't work, then a surgical consultation is best. I had a knee injury that would have needed surgery if I hadn't tried physical therapy first. Physical therapy helped me in many ways. It helped with inflammation, pain management, mobility, and balance, which I have none. So I was able to get balance, and it was amazing. I was able to get back up on my feet, and I was able to start volleyball all over again. People are often told that surgery is the only option, and that is not true. Physical therapy is very helpful, and when doctors say that surgery is the only option, it's not true. Surgery can have many beneficial effects, but it can also have negative effects. More surgeries afterwards if it doesn't work, more time to recover, more money. It's just not always the best solution. Surgery is not always the best solution, and it takes a lot of money and time to recover. The seriousness of the injuries is always better to see if physical therapy will work or surgery will work. There is no way to tell unless you start physical therapy first. If you jump right into surgery, you may not get the result you want. There are surgical complications that can happen, and it's not always the best. If the injury has not made progress with physical therapy, they will try surgical consultation, but more often than not, physical therapy helps best. There are many common problems for the average person to have that need physical therapy, like back pain, muscle pain, and joint pain, knee pain, and many other things that physical therapy can help with. My uncle had a herniated disc, and the doctors told him surgery was the only solution because of how bad it was. While going to the chiropractor and with the right exercises and stretches from physical therapy, he was back up and ready in a few months. He didn't need surgery in the end, and they were pushing hard for it, which shows a lot because it was a really bad herniated disc. So he did a lot of stretches like knee to chest, back bridges, many back stretches that helped in the long run. It helped a lot for him, and he swears by it now. Physical therapy is amazing. When I had my knee injury, it was because of volleyball. I went to dive for a ball and I hit my knee in a very awkward position. With that knee injury, I had a knee the size of a grapefruit. It was bruised and swollen, and we couldn't get it down. We tried icing for 15 minutes at a time, which you can only do or you will damage the joint or muscle that you're trying to help in the long run. So we tried that first, and it didn't help. So then we went to the doctor for it, and the doctor recommended us to a physician who said surgery. But then another physician was called, and we went to him for a consultation, and I got a steroid shot in my knee to help the inflammation go down. And then he recommended physical therapy, and it helped tremendously. At physical therapy, it was amazing. I got to stretch my knee in the right way, and advanced physical therapy swears that with the right stretches and the right physical exercise, and even STEM therapy, which is electrocution therapy, which helps stimulate the muscles. It helps a lot. But the seriousness and the genetics of the person's injuries always stem with how that is going to affect whether or not they have surgery or physical therapy. It always depends on the diagnosis of the injury itself. In conclusion, physical therapy is a better option. In the long run, it'll help better, less time, less money. You won't have surgical complications or the risk thereof. You won't have to have surgery again, because more often than not, with back pain or neck pain or knee pain, you will have to have surgery over and over again to try to correct it. And you just don't want that. It costs a lot of money and takes a lot of recovery time. And even afterwards, you're going to have physical therapy to try to get mobility back. Mobility and movement are very, very key things you need in life to move, to walk, to do anything. So physical therapy really helps with that. Some exercises like crunches, knee to chest, bridges, they always help with back pain. And if you have back pain, I hope you can use some of these. Lay on your back, put your knee to your chest, and then hold that position while wrapping your arms around your knees, and then rock back and forth, and that'll help massage your back. My uncle learned that with his herniated disc, and it helped a lot. There are many things that surgery cannot help with. Muscles can be torn, and you need rest, ice, elevation, and many other things. But if you stretch it the right way, you can get it back up and running in no time. Physical therapy is amazing, and it helps tremendously. I can't stress that enough. With my uncle and I's injuries, it helped so much, and I know a lot of other people who had injuries very similar and more serious than ours that were helped as well. There are many physical therapists who actually specialize in vertigo, which is a dizzy spell, and there are stretches you can do with consulting with the neck. If you move it the right way, you can get the crystals in your ears to go back into place, and then it'll help with the dizziness. Physical therapy helps in many ways. It has helped so many people and is a much better option than surgery. And I hope you guys will understand that. And I hope you guys use that in case you do have an injury that needs physical therapy. But if they say surgery first, always ask for physical therapy, because more often than not, physical therapy can help you much better and easier than a surgery can. It's less money, and it is more efficient. Thank you, and I hope you enjoyed this.